The panel of experts who assessed alleged arsonist Zandile Mafe have recommended that he be referred for psychiatric treatment. Now, he's facing charges of setting alight the Parliament building back in January of 2022. Experts believe he is not fit to stand trial for terrorism and arson. So how are these assessments conducted, and typically what do experts look out for? Let's get some feedback there from Dr. Giada del Fabbro, who's a forensic and clinical psychologist, joining us. A very good afternoon to you. Thank you so much for your time. A panel of experts who assessed Zandile Mafe don't believe that he'll be able to defend himself properly in a trial because of his disordered thoughts and delusions. How are these assessments typically conducted?
Hi, good afternoon. So really what happens is an individual that's, with the questions around their capacity and responsibility for a crime and being able to conduct their own defense get referred for a 30-day observation period at a psychiatric institution. And what you'll find there is there's a team from psychiatrists, psychologists, social workers, occupational therapists, nurses, who observe this person over that time period. And what they will look for is a consistency in sort of the behavior that may be problematic. So, for example, if this man is delusional and he has certain ideas that he's speaking about, they will look and see that over that time period, that doesn't change. What this ensures then is that someone's not able to sort of fake being psychotic or delusional to get away from facing a prison sentence, for example. And with a team made up of so many different people, you've got a lot of different perspectives and viewpoints that come together to form a profile of this individual. There would also be psychometric testing, so you'd look at tests that looked at thought process, thought content, and substantiated whatever views the team were getting from their clinical impressions.
What type of experts make up this team?
So you'd have, generally you'll have people that have had experience in forensic psycholegal observations. So there would be a psychiatrist, a psychologist, social worker, nurses, occupational therapists sometimes, which form this panel.
So, on the other hand, is Zandile Mafe's lawyer, Dalim Pofu, who disagrees with what the panel of experts have recommended. He's told an inquiry into his fitness to stand trial that the experts were being subjective over Mafe. What are experts typically looking out for to draw this conclusion?
So, the expert's role is really to be objective. So, they're just looking to see diagnostically what's wrong with this person. Is there something? So they would be looking at thought patterns, thoughts, ideas that one wouldn't consider to be based in reality. They might be looking for hallucinations, or seeing things, hearing things, and that there really wasn't a logical pattern to how this person thinks about the world. They would also be looking at his rationale for what he did, whether that makes sense, whether that's logical, and on that basis, getting a sense of how realistic he'd be able to appreciate the contents of a court case, his defense. And I think what came up also is that cognitively, this man is not stupid. It's not that this person's not intelligent. They are able to function, but it's that their view of the world is distorted. So, the two things, one doesn't necessarily impact the other.
Yeah. The lawyer also objected to the psychiatrist's explanation that the panel's diagnosis was schizophrenia, complaining that it contained no detail on how the panel came to this conclusion. What sort of detail would typically be required of such a diagnosis?
So you'd want sort of a psychiatrist that is experienced and trained in this to come up with that diagnosis. You'd also look at responsivity to medication. So if, for example, they saw that he was quite responsive to an antipsychotic, then maybe that would substantiate. You'd also find psychometric tests. So these are tests that screen for symptoms of various disorders, so they could substantiate, and probably records of how this person has behaved over the 30 days, which would probably illustrate some of the bizarre behaviors and thoughts and ideas.
Should, all of this be ignored, what kind of a defense would Mafe present if medical experts believe that he's illogical and disordered?
Well, you see, I think he would be, I think it would be quite contrary to the court process. It would be quite disruptive.
Okay, we appear to be losing you there. I don't know if you can still hear us, Dr.
And it wouldn't be fair to hear him, actually. This is what we're looking at. That he's not... Yes, I can. Can you hear me?
Yes, we can hear you now. I'm hoping that it won't distort again.
Okay, let me try this. Let me know if it distorts. But what you're really looking at is someone that needs to fully understand how they're being represented in court. And he won't. He's going to insist that what he did wasn't wrong, but it's not because he truly does want to be a terrorist. It's because of his delusional thought pattern. And I think that could disadvantage him incredibly in the justice system, because his acts were not based on a fundamental, sane, reasoned choice. They were a product of his delusions. So what you find is that if he's treated in a psychiatric hospital and those delusions go away or minimize, he's suddenly going to probably be quite surprised, shocked, upset about the things he did.
So what would typically happen in an instance like this to the case and the allegations pinned against him?
So what happens really is that he won't face a criminal sentence. He'll be sent to psychiatric hospital where he'll be treated, and then periodically a review board will come up and assess whether he's a risk, whether he can be discharged or whether he needs further treatment. So they'll assess his risk of being in the general public.
So very lastly, you touched on this quite very briefly. If a legal expert disagrees with what the panel of experts have recommended, how does that now impact the case?
Well, I guess it would be for the court to decide.
Yeah.
The court will have to weigh up the evidence, and on the basis of that, make a decision around what's the best way forward. But it would be, I'm not sure what the strategy is, but in terms of the defense, but in some ways, it's actually the fairer route forward for this individual, given what the panel has found.
Yeah. Okay, we're going to have to leave it there for now, but thank you for your time.